You feel completely fine. You have no pain, no stiffness, nothing that would make you think anything is wrong. And yet, right now, there is a condition affecting roughly 1 in 3 adults over 50 that produces absolutely no symptoms you can feel until the day a bone breaks. It is called osteopenia. It is the early stage of bone density loss. And for most people, the first sign they ever get is a fracture from something that should not have caused one. A stumble, a minor fall, sometimes even just bending the wrong way. Doctors call osteopenia, and its more advanced form, osteoporosis, the silent diseases. Because your bones can be quietly losing density for years while you feel entirely normal. In this episode of Decade Body, we are going to walk through exactly what osteopenia is, why it develops so silently, who is most at risk, and the specific steps you can take right now before you ever feel a single symptom. This is what your bones are doing while you feel completely fine. Let's start with what is actually happening inside your bones. Your bones are not the static, dead structures many people imagine. They are living tissue, constantly being broken down and rebuilt in a continuous process called bone remodeling. Old bone tissue gets cleared away, new bone tissue gets laid down to replace it. In your 20s and early 30s, bone formation outpaces bone breakdown. This is when your bones reach what is called peak bone mass, the highest density they will ever achieve. After that, the balance gradually shifts. Bone breakdown starts to slightly outpace bone formation. This is a completely normal part of aging. But for some people, that shift happens faster, or starts earlier, or goes further than it should. Osteopenia is the medical term for bone density that has dropped below normal levels, but not yet dropped far enough to be classified as osteoporosis. Think of it as a warning marker on the road, not the destination itself. Roughly 44 million adults in the United States alone have osteopenia. About 1/3 of all adults over 50 have some degree of bone density loss. And here's the part that matters most. Osteopenia, almost without exception, causes no symptoms you can feel, no pain, no warning sign, nothing that tells you to go get checked. You might be wondering why something this significant produces 0 symptoms. The answer lies in how bone tissue is structured. Unlike muscles, which send pain signals when they are strained, or skin, which sends pain signals when it is damaged, bone tissue has very limited nerve supply in the areas where density loss occurs. The outer surface of bone, called the periosteum, is sensitive to pain, but the internal structure, the trabecular bone, where density loss actually happens, has almost no pain receptors at all. This means your bones can lose 20, 30, even 40% of their density with you feeling absolutely nothing different in daily life. You can walk, exercise, lift, and go about your entire routine with no physical indication that anything has changed. The first symptom most people experience is not a symptom of osteopenia at all. It is the consequence of it, a fracture, and often it is not even a dramatic fall. It can be something as minor as missing a step, twisting awkwardly while gardening, or a low-impact bump that, on a healthy bone, would never have caused a break. This is precisely why bone density loss has earned its reputation as a silent condition. By the time most people find out, the loss has already been happening for years. Let's talk about who is most affected, because the risk factors are not evenly distributed. For women, the single biggest driver is menopause. The hormone estrogen plays a critical role in maintaining bone density by regulating the cells that build and break down bone tissue. When estrogen declines during perimenopause and menopause, bone breakdown can accelerate significantly. Some women lose up to 20% of their bone density in the 5 to 7 years following menopause. For men, the equivalent hormone is testosterone. Lower testosterone levels are linked to higher rates of bone density loss, though the decline tends to be more gradual than the female experience around menopause. Beyond hormones, several other factors increase risk for both men and women. Family history plays a meaningful role. If a parent had osteoporosis or experienced a hip fracture, your risk is elevated. Body frame size matters too. Smaller, thinner body frames generally have less bone mass to begin with. Certain medications, including long-term steroid use, can accelerate bone loss, and thyroid conditions can also significantly impact bone density. Lifestyle factors matter as well. Low calcium and vitamin D intake over many years. Sedentary lifestyle, since bones respond to mechanical load from movement and weight-bearing activity. Smoking and excessive alcohol consumption both interfere with the bone remodeling process. The action step. If any of these risk factors apply to you, this is worth discussing directly with your doctor, particularly your menopause status, if you are a woman, and any family history of fractures or osteoporosis. Since osteopenia produces no symptoms, the only reliable way to detect it is through a specific type of scan. It is called a DEXA scan, short for dual energy X-ray absorptiometry. A DEXA scan is quick, painless, and involves significantly less radiation than a standard chest X-ray. It typically takes around 10 to 20 minutes. You lie on a table while a scanning arm passes over your body, most commonly measuring density at the hip and spine, the two locations where fractures tend to have the most serious consequences. The results are expressed as something called a T-score. A T-score between -1 and -2.5 indicates osteopenia. A T-score below -2.5 indicates osteoporosis. A T-score above -1 is considered normal bone density. So when should you get one? General guidance suggests women should consider a baseline DEXA scan around age 65 or earlier, often around 50 to 55. If risk factors are present, such as early menopause, a family history of fractures, or long-term steroid use. For men, screening typically begins later, often around 70 or earlier, if specific risk factors apply. But here is the important nuance. If you have risk factors, and many people in this 45 to 60 age bracket do, particularly women navigating perimenopause or menopause, getting screened earlier than the general guidelines suggest is often appropriate. The action step. Ask your doctors directly whether a baseline DEXA scan makes sense for you now, rather than waiting for the standard age guideline. A baseline scan in your 50s gives you a reference point, so any future scan can show you the trend, not just a single snapshot. Here is something genuinely encouraging. Unlike osteoporosis, which is generally managed rather than reversed, osteopenia can in many cases be improved or even returned to normal bone density. This is an important distinction. Osteopenia being diagnosed does not mean an inevitable progression to osteoporosis. With the right interventions, many people stabilize their bone density, and some meaningfully increase it. The first and most evidence-backed intervention is resistance and weight-bearing exercise. Bone tissue responds directly to mechanical stress. The load placed on it during activities like walking, resistance training, and impact exercise signals your body to maintain and build bone density. This is not a minor footnote. It is the single most effective lifestyle intervention available. The second is adequate calcium and vitamin D intake. Most adults over 50 need approximately 1,000 to 1,200 milligrams of calcium daily, and vitamin D levels optimized to 40 to 60 nanograms per milliliter. Not just within the broad normal range, but at a level that genuinely supports calcium absorption and bone remodeling. Some research has also explored collagen peptide supplementation alongside calcium and vitamin D, with early studies suggesting potential additional benefit for bone density in postmenopausal women, though this is still an area of ongoing research. For women navigating menopause specifically, hormone therapy, which we discussed in detail in a previous episode regarding its effects on weight loss medication outcomes, also has well-established evidence for reducing bone loss, since it directly addresses the estrogen decline that drives the process. The action step. If you are diagnosed with osteopenia, ask your doctor specifically what reversal or stabilization looks like for your individual case, rather than assuming it is something you simply have to live with.
Here is a connection that surprises most people, and it is worth understanding. Recent research has found that reduced bone mineral density is associated with subclinical atherosclerosis, the early symptom-free buildup of plaque in the arteries in postmenopausal women. In one study, women with osteopenia or osteoporosis had a significantly higher prevalence of carotid artery plaques compared to those with normal bone density. The connection is not fully understood, but it likely involves shared underlying mechanisms. Declining estrogen affects both bone remodeling and vascular health simultaneously, and chronic inflammation may be a common contributing pathway to both conditions. What this means practically is this: bone density is not an isolated, separate health marker. It may be a window into broader cardiovascular and metabolic health, particularly for postmenopausal women. A bone density scan, in this light, is not just about fracture risk. It may also be flagging information relevant to your heart health. This is exactly the kind of connection Decade Body exists to surface. The places where one part of your body's aging story is quietly informing another. Let's bring this all together. Osteopenia affects roughly 1 in 3 adults over 50. It produces no symptoms you can feel. The first sign for most people is a fracture that should not have happened. And by the time that fracture occurs, the bone density loss has typically been progressing for years. But here is what makes this different from many of the topics we cover on this channel. Osteopenia is genuinely actionable and in many cases reversible. A DEXA scan gives you a clear, objective baseline. Resistance and weight-bearing exercise is one of the most powerful tools available to you, and it is entirely within your control. Adequate calcium and vitamin D support the process. And for women navigating menopause, hormone therapy is a well-evidenced option worth discussing with your doctor. This is not a condition to fear. It is a condition to know about early enough that you can act on it before it ever becomes a problem you feel. If there is one thing to take from this episode, it is this: you cannot feel your bone density declining. The only way to know is to ask and to get scanned. That single appointment, a conversation with your doctor about whether a baseline DEXA scan makes sense for you, may be the most important 5 minutes you spend on your long-term health this year. Subscribe to Decade Body for your weekly preparation guide. We release a new episode every week, and every one of them is built around the same principle: knowing what is coming so you can prepare before it arrives. If this episode gave you a reason to book that conversation with your doctor, that is exactly what this channel is for. Share it with someone over 50 who feels completely fine right now. They are exactly who this episode is for. Know your decade, own your health.